illegal immigrants through charity care and now through this new healthcare system, when the medical profession as a whole places liens or garnishes salaries of U.S. citizens who are homeowners and have jobs, when clearly, no matter where illegal immigrants have come from, they do have a home in their country of origin that cannot be tapped. Now you've answered that for me clearly by suggesting amnesty for these people who are going to benefit from our system, including a medical healthcare system that the majority of Americans don't even want. Not all people have secondary and supplemental insurance. Not all also have benefit of a pension and savings. My late mother only had her Social Security, and her home in Hackensack was not worth a lot. So, yet she was still obligated to pay whatever in 5 times being hospitalized in 8 months for a total of 66 days at Hackensack University Medical Center. She was obligated to pay. There was no charity care for her. There was nothing for her. She paid. But someone who broke the law to get here doesn't have to. I have a problem with that.
So do I.
And everyone should have a problem with that, including you. My second question, since healthcare is a moot issue with you, obviously you voted for it and the majority of Americans are not in favor of it. My second question is, what is your position on the future security of Israel, one of our strongest allies? Let me get done. What is your position on Israel? The Obama administration has been very negative towards them. They only made nice recently, and that's just PR for an election. And people think the Americans are stupid enough to buy it. So what is your position? Since you were in favor of Obama from the primary, I need to know. You endorsed him from the beginning, so I need to know what your position is. I think everybody needs to know.
If you, since we have lots of people, if you give me all your questions, I can then answer.
Okay, my last question. I'm going easy on you. But as long as I'm able to respond back. My last question then would be, most recently I brought the articles and the download if you need it. Oh wait, can I go back to healthcare for a second?
Yes, I just want to make sure we get to as many people as possible.
Okay.
You've asked 2 questions already.
Okay,
Would you like to ask the third?
The third question would be then, the Cuban dissidents most recently have applied to Congress asking the U.S. to ease its embargo on their country. I need to know what your position is on that as well.
Okay, thank you. If you give the mic back to Mr. Duchesne, I will answer your questions and then we'll move on. First of all, I share your, say, you should have a problem with people getting charity care, with anybody going to the emergency room and expecting not to pay, whether they're legal documented or illegal. And I agree. Nobody should get something for nothing, unless they're they're an American citizen and they have certain rights, or a legally documented permanent legal resident who has legal rights under our system. But nobody should go to the emergency room and expect not to pay. And the law is that if you go to the emergency room, you're gonna get a bill. Some are illegals and they just don't pay. Some are legals and just don't pay. Some are legals and pay the full thing right away. Some are legals and negotiate scheduled payments, etc. And your mom sounds like a person who had the ability and the integrity to pay what she consumed, the healthcare services in the hospital. But charity care doesn't mean come in and we're going to forgive, oh, you don't have to pay. Charity care means that what the hospital lays out in terms of services but doesn't get back because the people didn't pay their bill, either the state or the federal government or someone else will pick up the tab. And by the way, some of the tab, the largest part of the tab is being picked up by us. Legally documented Americans who have health insurance. We get charged $10 an aspirin, not because it costs $10 to the hospital for an aspirin, because it costs them 50 cents, and the other $9.50 they used to pay for the people who came to the hospital and didn't pay their bill. So we're paying for it. And one of the reasons I voted for the health care reform bill is that it requires everybody to have a health insurance policy, gives assistance to those with incomes under $88,000 a year per household, and allows everybody to be in a larger pool so that our insurance we have the opportunity to have a smaller premium than we would otherwise if we went in as an individual to negotiate. In addition to no pre-existing conditions, no caps on the coverage, getting your children on your insurance policy. But so I have the same problem you do about illegals. So now I'm going through your questions, ma'am. I'm going through your questions. You may disagree with what I'm saying, but I gave you the courtesy of listening to you. I hope you'll give me the courtesy of listening to me. I hope you will give me the courtesy of listening to me like I gave it to you. On the subject of the health care reform bill, you said, ma'am, that illegals will be entitled to receive health insurance benefit under the new Health Care Reform Act, and you, with respect, are completely incorrect. It says expressly in the law. It says it expressly in the law that unless you are a legally documented resident of the United States, you cannot receive any benefits under the law. Next, on the question of amnesty. On the question of ma'am, are you going to be rude to everybody or just me?
It's just you.
Just you. Well, then I think it's unfortunate. We'll move on to the next question.
I want to hear her answer.
Well, she doesn't want to hear my answers. She's not letting me speak. Do you want to hear my answers?
Yes.
Then please ask this gentle lady to let me speak. With regards to amnesty, the gentle lady says that I'm proposing amnesty. I'm not proposing amnesty. I'm proposing conditions by which have to be met: paying of back taxes, paying of penalty, learning of English, getting in the back of the line. Now, what was amnesty was our late and beloved President Ronald Reagan giving 5 million Americans amnesty with no conditions. No conditions. No conditions. That is the definition of amnesty, in my opinion. Now, finally, with regards, two things. You wanted to know about Israel and Cuban Missile. I have been, if you wish, I will send you, unless you have already read them in the Record or the Star Ledger or the Jerusalem Post or Bloomberg or all the places that I've written, I'll be happy to send you the various articles I've written about the U.S.-Israel relationship, strategic and intelligence. I have the privilege of serving on the House Defense Appropriations Subcommittee, the 16-member subcommittee that recommends all the military spending for the United States of America. The 16 of us. I'm the first Bergen County member of Congress ever to serve on the Appropriations Committee in the House in the history of the United States. I'm also on the Foreign Operations Subcommittee of Appropriations. So, my first trip to Israel was in 1968. So, to say that I have an interest in the region, I think, is borne out by my present work and my lifetime's worth of attention to the region. I'll be happy to send you why I believe the relationship has never been stronger in terms of our U.S. military and intelligence relationship. And as a matter of fact, if you read the transcript of President Obama and President Netanyahu's just concluded conference at the White House, you'll see that they feel the same way. If you speak to the leaders of the U.S. military,